Hi, I'm Dr. Melanie Dunlap, and in today's age of the COVID-19 coronavirus, we're hearing a lot of talk about risk factors. The Centers for Disease Control have identified on their website what they consider to be the things that put a person in the high-risk category. Those would be an adult age 60 and older, someone with a chronic lung condition, someone who's immunocompromised, such as receiving cancer treatment, someone with diabetes, or someone with a heart condition. As we learn more about the coronavirus, those are subject to be updated. So I'm going to encourage you to go to the CDC website regularly and keep yourself informed. As a natural health practitioner, I always encourage my clients to look at themselves holistically, to look at everything when they're making health decisions. And your risk factor for the coronavirus is no different. Some things you might not have considered are, have you had a recent injury? Maybe you've had a broken bone, it's still in a cast, it's still in a boot, or maybe you just have gotten over an injury like that or some other injury. That would be a consideration. If you've had past lung issues, here in the desert we have something called valley fever. If you're someone who's had that in the past, that's a consideration. If you're someone who has completed cancer treatment in the last year. And then another big factor that people really don't think about is grief. From an energetic standpoint, we recognize that grief is stored in the lungs. And so if you're someone who has recently had something that has caused you a lot of grief, then that would be a part of your consideration and your risk factors. It's up to each one of us individually to decide what risk category we fall into. Talk that over with a natural health practitioner. Really get to know what is going on for you and take a wider view of that. Let's keep washing our hands, keep social distancing, and doing the things that we know we need to do in order to stay healthy. Remember, we're all in this together. I'm Dr. Melanie Dunlap. Make it a healthy day.